Hi, welcome to It's Time with Shari. I'm your host, Shari Hinete Ilon. As we welcome year 2018, I would like to encourage all of you to take care of your heart because it is important to always be healthy and happy. And they say that the #1 killer in the world is cardiovascular disease. And so I'm very happy to have with me today the president of the Philippine Heart Association in Negros Occidental, no other than Dr. Alan Tenerife. He is a cardiologist. Good morning and welcome to It's Time with Shari, Doctor.
Good morning, Miss Cherry, and good morning sa atong tanan nga audience.
Yes, of course, with me and with Dr. Tenerife are also the board members of PHA Negros chapter, Dr. Mary Stephanie Varela. Hi, Doctor. Welcome to It's Time with Shari.
Good morning, Ms. Cherry.
And of course, Dr. Ed Gabitoya. Dr. Gabitoya is a cardiologist and a vascular specialist. Hi, Doctor.
Good morning.
Welcome to It's Time with Shari. Okay, so they say that cardiovascular disease is the #1 killer in the world. Why do we say this, Doctor?
The global burden of cardiovascular disease is very high. So even the highest leading cause of mortality is cardiovascular disease. So when we say cardiovascular disease, this would include stroke and the cardiac diseases in general, and even hypertension. So it is said that 20% of deaths worldwide is due to heart disease, and out of this 20%, almost 50% are due to sudden cardiac arrest.
Okay, sudden cardiac arrests, meaning to say, without warning, you could just have that cardiac arrest, no? 20% or how do you have the statistics of this?
Also, actually, in the Philippines, it was noted that around 20% of the leading cause of morbidity and mortality. So this would include all the when we say morbidity, this would include hospitalizations due to hypertension, heart disease, and stroke. And when we say mortality, this pertains to the number of deaths due to disease. And cardiovascular disease would account to 20 to 25% of deaths in and out of the hospital.
Yes, okay. Doctor, I have a lot of friends who are hypertensive, no? Some are as young as 25 years old. They are already hypertensive. What brings about, because I think this is the most common of all, hypertension. What brings about hypertension, Dr. Varela?
Actually, hypertension is genetically programmed na in our body. So, if you have a family history, or like, for example, a first-degree relative, like parents mo, high blood dun sila, then the children will also have an increased risk of developing heart disease. This cannot be cured, but it can be controlled with medicines and with a healthy lifestyle, as well as diet.
Okay, you have said healthy lifestyle and diet. We will get into that, no? Okay, what about stroke? Because they say, ay, na-stroke na siya, wala siya kabalo, na-stroke na siya gali, no? There are many incidents of stroke nga you did not even know that you had already had stroke. Dr. Gabitoya.
Yes, actually, kadamo gid sang incidents of mild stroke that even patients do not notice they had one. Maybe because the presentation siguro is very subtle, but you look at the patient in general, of course, most of these patients who even have a mild stroke has actually may mga risk factors gid.
Yes.
And as you mentioned earlier, a lot of of your friends have hypertension. In fact, yes, hypertension is one of the common risk factors for this cardiovascular disease that include the stroke incidents.
Yes. You have mentioned, Dr. Varela, that this can be controlled and managed, no, through healthy lifestyle and diet. Could you elaborate on this?
The cardiovascular diseases in general have a lot of risk factor, not only high blood pressure.
Yes.
So this can include also your diabetes, the family history of coronary heart disease,
Yes.
even smoking, which as well as your intake of high cholesterol food can all contribute to the development of cardiovascular disease. So once you are diagnosed with high blood pressure, then you are high blood pressure for life. But environment as well as your diet can modify this. It doesn't really need to progress into heart attack or stroke if you if you, uh, you know, use a healthy diet, for example.
Yes.
So this you can do by limiting the salt intake.
Yes.
Because the higher the salt intake, the higher the blood pressure. By also promoting a healthy lifestyle by moderate physical activity
Yes.
daily. So you go exercising, moderate intensity. Of course, you have to go at your own pace.
Yes.
But you have to aim to at least 30 minutes to 1 hour a day.
It's good that we have you, our doctors, our cardiologists, who are very much active now in trying to disseminate information to stop, or shall I say, control cardiovascular diseases. This is called Philippine Heart Association, Doctor. Please tell us about this organization.
So the Philippine Heart Association is a national medical organization which is composed of over 1,600 medical professionals and laypersons involved in cardiovascular research, in the treatment of cardiovascular diseases, and in the dissemination or the information to the public regarding awareness for cardiovascular diseases. In the whole country, the Philippine Heart Association has 13 chapters
Yes.
all over the country. And in this part of Region 6, we have the Western Visayas, PHA Negros Occidental Chapter. And right now, we are composed of 21 cardiologists or medical doctors involved in the management of heart diseases among adults.
Yes.
And we have two pediatric cardiologists or medical specialists treating cardiovascular diseases among children.
Yes.
So we are we are also a growing organization because as of now, we have several young doctors aspiring to be cardiologists who are right now in training among the different medical centers in Manila.
Yes.
And we are a very active organization because we are involved not only in continuing medical education for our fellow medical doctors, but also to laypersons. So we are involved in education of both doctors and laypersons.
Yes, no, they say ganiya basta heart na naiya, that is very sensitive, and we are happy that there are 21 already of you here in Negros Occidental, no, and growing pa ang number. Okay, so you have this campaign of 52100, no, ang PHA. Please tell us about this, Dr. Varela.
So 52100 lifestyle is one of the prominent advocacies of the Philippine Heart Association or the PHA. So it is a guide for everybody, children and adult, how to achieve this lifestyle. The main purpose of this is to reduce the incidence and development of cardiovascular disease. So these numbers are actually tell us what are the important component of a healthy lifestyle. So the 5 here stands for 5 servings of fruits and vegetables per day.
Yes.
Okay? And then we have here the flyer or the poster, I mean. So the 2 stands for 2 grams of added salt per day because we really should limit the salt intake to minimize high blood pressure and other diseases.
Yes.
And 2 also to reduce to maximum of 2 hours screening time. When we talk about screening time, it's the time that we spend watching TV or playing in the computer, surfing the internet, because if you're doing that, you become sedentary.
Okay.
So,
What about if your work is really in front of the computer for 8 hours?
yeah, I know. So when that happens, you cannot
Yes.
do anything about it. So the next thing would be the 1 hour exercise per day. So you really have, even if you're busy, you really have to find time to
Yes.
exercise at least 1 hour per day.
Yes.
Or you can always start with a minimum of 3 times a week.
Yes.
Okay?
I also see, or do the 4-minute workout.
Yes, yes.
4-minute workout,
yes.
alternate na siya.
Yes, yeah, alternative.
See.
Okay. And then the 0 stands for 0 or no sugar or sweetened drinks or sodas.
Yes.
So as much as possible, we want to encourage everybody to drink more water.
Yes.
Yes. And then 0 finally to smoking.
Yes.
So we would like to educate the children especially to please not or avoid smoking
Yes.
firsthand as well as secondhand, because
Yes.
this can have a lot of detrimental effect to the cardiovascular system.
Okay, so that's very easy to memorize. 52100. 5 servings of fruits and vegetables, maximum 2 hours of added salt, 2 grams.
2 grams.
Wow, 2 grams. That's very little, no?
Yes.
So your food would be not as tasty as
Yes,
it
a
would
little
be.
bit bland. But
Okay.
we encourage this especially for the hypertensive individuals.
Yes.
But nowadays children are very fond of eating junk foods.
Yes.
And if you look on the back at the nutritional facts,
Yes.
it has a lot of salt.
So no to junk food. And then 1 hour of exercise.
Exercise per day.
Yes, per day.
Moderate
0.
intensity,
Yes.
yes.
Dapat, hindi man pwede, may mga heart problem, basi birabiras na
Yes,
gulpidok,
oo.
no?
It
Kag
should be
matumba, wala
tailored,
pa-
oo.
Okay, so, and of course, you've got to see your physician before you do any strenuous physical activity,
Yes.
no? 0 or no smoking and no sweetened beverages.
Yes.
Okay, what about this CPR, cardiopulmonary resuscitation? Dr. Gabitoya.
Another advocacy of PHA is actually the CPR.
Yes.
Actually, the vision of PHA is to be CPR-ready Philippines by the year of 2021.
Okay.
No, so that's the vision. Actually, CPR or the CPR Council, that's part of the PHA, is already present way back 1982. No? And they are teaching layman as well as doctors to do the cardiopulmonary resuscitation. Well, the reason for CPR, this is actually one thing that we can do to a patient who had sudden cardiac death. Mga baka
Yes.
sudden cardiac death, they usually collapse or loss of consciousness related to a cardiac event, and usually
Yes.
that's a heart attack. No?
Yes.
Remember, heart attack can happen to anybody.
Yes.
It can happen anytime, and it
Yes.
can happen anywhere.
Yes.
So even at your home, in the establishment, it can happen. So if lay persons are trained for CPR, they can actually save lives.
Okay, that is scary, doctor, no?
Yes.
It can happen to anyone.
Yes.
Anytime.
Anytime,
Anywhere.
anywhere.
OMG. So what should you do if you see someone just suddenly collapse? You don't know what happened to him. What should you do?
Yeah. That's why part of the promotion or promulgation of the PHA is to teach individuals regarding hands-on CPR.
Yes.
Actually, we have a short, also a mnemonics for that. So
Yes.
we remember the 3 C's,
Yes.
letter C. So one is to check on the patient and the environment. Is the environment safe? You check on the patient. Is the patient unresponsive? The second one is you call for help.
Yes.
You can use your cell phone. You can ask somebody to call for help, call an ambulance, no? And the last C is doing the CPR.
Okay.
It's the CPR.
How do you do the CPR? Even if we will show the video, no, while you are
Yes.
saying it, doctor. But briefly, how would you describe doing the CPR?
The CPR is usually what we are teaching is the hand-only CPR.
Yes.
So we don't give the breathing. We just ask the individual to do the hands-on CPR. So by placing the both hands, no, sa chest
Yes.
ng patient, in between the or in the breastbone,
Breastbone.
no, you press on it as hard as you can and as fast as you can.
Okay, so
no?
per 2 seconds or
2
2
minutes.
pumps. Okay.
No, 2 minutes
2 minutes.
of
2 minutes of
yeah,
pumping.
Of pumping.
Yes.
So that activity is also exhausting. That's why you
Yes.
need somebody also to help you out. no?
Yes, no.
That's why the second step, you need to call for help because the provider of the CPR can also be exhausted.
Yes, no. And it's also important to have emergency numbers on your cell phone.
Yes.
So you can use it anytime, no?
Yes.
Kaya basi, anong number tawagan ko? Masala na kinahanglan, don't panic. No?
Yes.
Very important.
Very
no?
important.
But is there a venue for you to be able to train lay people on how to conduct CPR?
Yes. Actually, we've been doing the mass CPR campaign since
Yes.
2016. I think we started that March 2016. The target trainees were students from the University of St. La Salle and UNUR.
Yes.
Last year, we did the mass CPR, March
Yes.
of 2017.
Yes.
And we trained security guard and employees of SM City.
Okay, no? Kaysa nagalagaw-lagaw sa mall,
Yes.
gulpi lang, no? Kinanlan ka balota. Oh, that's wonderful. Thank you very much, Dr. Gabitoya. Dr. Tenerife, when we return, I would like to ask you more about the celebration of the World Heart Month, no? So, what are the things that we ought to do, what are the things that we ought to remember to make sure that we stop this number one killer in the world, which is cardiovascular disease? Please stay with me here on It's Time with Shari.
Mike? Okay ka lang, Mike? 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 Mike?
Cardiac arrest. Ito ang biglaang pagtigil ng normal blood circulation dahil sa failure ng puso na mag-pump ng dugo. Maaari itong mangyari kahit kanino kahit saan. Critical na mabigyan ng CPR o cardiopulmonary resuscitation ang sino mang makakaranas ng cardiac arrest. Para sa safety ng inyong mga mahal sa buhay, sundin ang mga sumusunod na steps para makapagbigay ng agarang tulong medikal at maagapan ang mga posibleng epekto ng cardiac arrest. Step 1. Check. Tignan ang kalagayan ng pasyente. Kumpirmahin kung siya ay na-cardiac arrest. Pagkatapos, agresibong gisingin ng pasyente
Mike? Mike, okay ka lang?
at tignan kung humihinga ito. Step 2. Call. Tumawag ng tulong. Ugaliing alamin ang mga emergency numbers sa inyong lugar at isave ang mga ito sa inyong cellphone.
Emergency? Kailangan namin ng ambulance na may AED.
Sige po, parating na po yung ambulance na may AED.
Step 3. Compress. Ipagkapit ang inyong dalawang kamay at ipatong sa gitna ng dibdib or breastbone. Gawin ang chest compressions ng malakas at mabilis gamit ang tamang bilang at lalim. Tandaan ang 3 hakbang sa pagbibigay ng CPR. Step 1. Check. Tignan ang kalagayan ng pasyente. Step 2. Call. Tumawag ng tulong. Step 3. Compress. Gawin ang chest compressions ng malakas gamit ang tamang bilis at lalim. That's it. Makabubuting malaman ng bawat Pilipino ang kahalaga ng CPR. Sa mga piling pagkakataon, ang CPR ay maaaring makapagligtas sa buhay ng mga mahal natin.
New, fully furnished. 3 bedrooms. Spacious receiving room, dining area, and kitchen. Your classy hotel in a strategic location, accessible with easy access to private and public utility vehicles. Ideal for visiting groups and families, with superior service and comforts of a hotel, yet uninhibited stay like a home. Jung's Realty Hometel. Since 1960, USI Credit and Finance Corporation, trusted for fast and personalized service. Chattel Mortgage, real estate loan, pension loan, and businessman's credit line. No processing fee, no hidden charges. USI Credit and Finance Corporation.
Welcome back. You're watching It's Time with Shari. I'm with Dr. Alan Tenerife, the president of Philippine Heart Association Negros Occidental Chapter, Dr. Mary Stephanie Varela, a cardiologist as well and board member of PHA Negros, and Dr. Ed Gabitoya, cardiologist and vascular specialist, also a board member of PHA Negros Occidental. We have talked about CPR, and this is one of the most important things that we should learn. In fact, an organization which I know, Amity Volunteer Fire Brigade, also actively campaigns for people to know how to conduct CPR, which is short for cardiopulmonary resuscitation. Dr. Tenerife, you have something to add about CPR.
I'd just like to elaborate on this advocacy on basic CPR or mass CPR. In 2014, we recall the case of a PBA icon, Samboy Lim.
Yes.
Samboy Lim was one of the greatest PBA stars in the 80s.
Yes.
And in 2014, while he was in an exhibition game, he suddenly collapsed and went into sudden cardiac arrest.
Yes.
And during that time, the people within the vicinity were not knowledgeable in terms of doing basic CPR. So there was some delay in instituting CPR. Eventually, Samboy Lim was brought to the hospital, and luckily he survived, but he lapsed into a coma for 1 month.
Yes.
So this underlies the importance of doing basic CPR.
Yes.
So it's not only that medical professionals should be familiar with doing CPR, because since we know that sudden cardiac arrest can occur anytime, anywhere,
Yes.
it's very important that even the laypersons are knowledgeable, because the studies have shown that when you do CPR as soon as possible, the chances of survival increases by 33 to 50%. So with regards to this advocacy, this case spurred the creation of a House bill which was authored by then Congressman Giao, in which this House bill seeks to incorporate basic CPR in our basic education system.
Yes.
So this was taken up in the Senate by Senator Angara, and it's very fortunate that with the lobbying also of various organizations, with PHA included, this House bill and Senate bill lapsed into a law last 2017.
Yes.
And this is known as Republic Act 10871. This is more popularly known as the Samboy Lim Law.
Yes.
So the Samboy Lim Law provides that basic CPR will be incorporated in basic education, especially for K-12 students.
Yes, that's wonderful, no?
Yes.
Students as young as maybe grade 6 up, or you said K-12, up to grade 12, they will know how to
Yes,
conduct CPR.
So actually the law is there, and we are awaiting for the implementation.
Yes.
So, but this will be incorporated in our basic education system eventually.
It has not yet been implemented.
Yes.
I hope the Department of Health will actively implement this, no? Because I think it's not easy for teachers, perhaps MAPE teachers, PE teachers, or science teachers to help students learn how to conduct CPR. Are you willing, PHA officers and members, to go around schools and actively campaign to promote CPR, Doctor?
That is why we are going to have this celebration next month,
Yes.
which is the World Heart Month celebration.
Yes.
And later on, I will elaborate that many of the guests in our activity, although this is an open to the public
Yes.
event, but we have particularly invited large teacher groups because we
Yes.
know that by teaching them CPR, which is part of this program,
Yes.
they would also be able to pass on this knowledge to their students.
Ay, that's good, no? So knowledge transfer and skills transfer training ang World Heart Month celebration too. But before we get into that, I would like to ask you, how does one know if he has symptoms of hypertension? He has heart problems, because it is scary to know, oh, it could happen to anyone, anywhere, anytime. But are there any indications or symptoms that you are already a victim of a cardiovascular disease, Dr. Gabitoya?
The manifestations of cardiovascular disease is actually wide range. It can go asymptomatic, meaning wala gid may ginabatsyag ang pasyente,
Yes.
to the one that has an impending doom, meaning
Yes.
laway na gid ila pamatsyag. No, asymptomatic because some of the patients, the cardinal symptoms would always be chest pain or hapo, no, shortness of breath. Some of the patients may not present that one, especially those who are female, elderly, diabetic. They don't present with the usual manifestations.
Yes.
But for cardiovascular patients or having heart attack, the common manifestation is a chest pain.
Chest
No,
pain.
chest pain.
Okay.
Or sometimes there will be shortness of breath or difficulty of breathing.
Okay.
So most of these patients actually have symptoms earlier than the attack. No?
Okay.
Meaning or weeks before or days before, they already have these symptoms. And
Okay.
usually naga full blown na lang during sa time they go into the hospital because of the severe manifestation.
Okay.
Pero as I mentioned, it can be a wide range of
Wide range.
manifestation.
But of course, these heart or cardiovascular diseases could be prevented, di ba? Because if hypertension might be genetics, other heart diseases or cardiovascular diseases could be prevented. And how could it be prevented, doctor? As you have, siguro ang 52100 is already one, no? No? And the lifestyle, the diet, no? They say gani, kung obese ang person, walking time bomb. No? Is that true, Dr. Varela?
Yes, that's true. Since Dr. Gabitoya has mentioned that some of these are asymptomatic in the
Yes.
beginning, it is important that we do screening.
Okay.
That's why, especially high blood pressure, it
Yes.
is known to be the silent killer because
Yes.
most of the time no symptom.
Yes.
And the patient does not know that he is or she is hypertensive unless she checks the blood pressure.
Yes.
So that's why part of our activity is to screen. We will do
Yes.
screening. We will check blood pressure. And it is also recommended at the age of 18 or 20, you really should start doing routine blood exams to
Yes.
check your cholesterol, your blood sugar.
Yes.
Because early on, there will be no symptom. And
Yes.
then once the symptoms would set in,
Yes.
it's a little bit late in the course of the disease.
Okay. In the month of February, most of you are excited about Valentine's Day. But our doctors here are excited about the World Heart Month celebration. Dr. Tenerife, please tell us about the World Heart Month celebration. That's on.
Okay.
Yes.
So actually, next month, the Philippine Heart Association will be holding simultaneous celebrations of Heart Month 2018 in the whole country, among the
Yes.
different chapters. But the main event in which the PHA National Officers and Board will be coming to Bacolod City to celebrate World Heart Month or Heart Month 2018 with us. No?
Yes.
So this coming event will be national in scope.
Yes.
And we are inviting the public because this is an open event. This is the World Heart Month celebration, which will be held on February 11, 6 a.m. at the new government center grounds. No?
Yes.
So what are we trying to accomplish in this celebration? We are trying to promote heart health and educate the public with regards to cardiovascular diseases, because we know that awareness is very important for the public to be able to safeguard their heart health. No?
Yes.
So for our World Heart Month celebration, at 6 a.m., we will be having free health screenings. So the public will be entitled to have a blood pressure screening,
Yes.
as well as screenings for blood sugar, cholesterol,
Yes.
and maybe some other examinations will be included in these free medical screenings to the public. And after that, we will also have lectures by our cardiologists on the 52100. Then we will also have a lecture and an actual demonstration of basic CPR, hands-only CPR. So for those who are interested, as I've said, we would like to emphasize that hindi lang kay medical professionals will be able to do CPR. Even a layperson who has no previous training would be able to learn it easily. No? So we will have also one of our cardiologists who will do the actual teaching and demo.
Yes.
And we will be having, we will be providing 50 to 100 dummies.
Wow.
And we will encourage the public to try their hand at actually doing the CPR.
Wow, I'm excited to do that.
So it's after that, no, we also have, in order to promote physical fitness, we have a Zumba fitness event. No, so
Yes.
we are encouraging the public to join this Zumba fitness event. We will have a Zumba group which will be on stage to guide the public on doing the Zumba. And we encourage everyone to join. And as an added incentive, we will be providing mga prizes, no,
Yes.
for those who perform well in the Zumba event. So this is not really a major competition for Zumba. It has more something to do with encouraging physical fitness among the public.
Okay.
And by the way, before that, on February 9, because this event will be held on February 11,
Yes.
we will be having an on-the-spot, PHA on-the-spot essay writing contest among high school students. So we have sent invitations to different public and private high schools, and we are asking them to send one representative to participate in this on-the-spot essay writing contest. We have encouraged them to study about heart health in general, and the topic will have to do something about heart health and with regards to the World Heart Month celebration. So by so doing, we are trying to encourage our young people, no, to study about heart health and be able to show their skills, no, in the field of essay writing. So this is part of our celebration. And announcement and awarding of prizes to those who will win in the essay writing contest will be done on the main celebration on February 11.
Okay, so it's going to be a fun and action-packed day on Feb 11 at the new government center here in Bacolod City. And you have personalities coming from Manila who are officers also of Philippine Heart Association. Now, I would like to ask you, Doctor, as cardiologists, what are the, shall I say, most rewarding experiences that you've had in your practice as cardiologist? May I start with Dr. Varela?
Well, I think educating the children, the young ones especially, because when you see your patients already with heart disease, sometimes you can only do so much. So some of us are also teaching in La Salle.
Yes.
So we try to educate the young ones as early as possible. And then because if we can save lives, if we can prevent disease, that would really be satisfying.
Yes. Dr. Gabitoya.
I think the most rewarding is, of course, the outcome of what you are doing to your patient. No,
Yes.
I think it's also one of the rewarding thing. At the end of the day, you've done your best. You save lives. I think that's one thing. And I agree with Dr. Varela. I'm also into teaching.
Yes.
Really love to teach. So I think if you show them the video for the 52100.
Yes.
It's actually designed for young individuals, especially children, because we know that cardiovascular disease doesn't start during adulthood. Actually, it starts during childhood.
Yes.
So we really need to stop atherosclerosis, which is the source of cardiovascular disease.
Okay.
So they will appreciate that in the video.
Yes. Now, so parents out there should also be wary of what they feed their children, no? It is also tantamount to responsible parenthood. Don't just give them pork all the time and fast food. No, make sure they eat healthy. I'm also reminding myself as a mom. Okay, Dr. Tenerife, what about you, doctor, as the president of PHA and a practicing cardiologist? What is the most rewarding experience you've had?
Like the experiences of my colleagues now, I think the most rewarding is when when you have a patient who is very critically ill in the hospital, then you're able to treat him or her, and after a few weeks, he follows us up at the clinic,
Yes.
and he is well. So that's one of the best experiences that you can have, no?
Yes.
And all of us cardiologists are involved also in the teaching
Yes.
of medical residents who will later become internists, and many of them have become trainees in cardiology. So
Yes.
spurring their interest in cardiology and teaching them how to treat cardiovascular patients are very rewarding experiences.
That's wonderful. So thank you very much, Dr. Tenerife, Dr. Varela, and Dr. Gabitoya. Dr. Tenerife, your invitation once more to the public to join and actively participate in the World Heart Month celebration.
Okay, so I would like to invite the public to join us in our World Heart Month celebration. This is open to everybody, and this is free to all. This will be held on February 11, 6 a.m. at the New Government Center. So what can we expect? We will have free medical screenings. We will have fun with the Zumba event, and if you're performing well, maybe you could win a few prizes. Then you could listen to our cardiologists who will teach the basics of heart health in our 52100 advocacy campaign. And we will have an actual lecture and demo on basic CPR, so that when you go home, you will be well equipped, because we know that sudden cardiac arrest could happen anytime, at any place. So even if you're not a medical professional, if you're trained in basic CPR, maybe you could save a life. It doesn't necessarily have to be that you're a medical professional. So we're inviting everyone to this important activity. So see you on our World Heart Month celebration.
Okay. Thank you very much, Dr. Tenerife. For Dr. Gabitoya and Dr. Varela, perhaps I would like to ask you, what is your usual message or advice to your patients, so that our audience here could also listen to that, Doctor?
Well, we should be particular in the food that we eat. We should adopt the healthy lifestyle and diet as what we are promoting, the 52100. We should educate our children early on. We should do some screening so that we can detect early the presence of hypertension, which we can modify the outcome later on. And then also we should also check the blood sugar of our family members and relatives, because diabetes can also be asymptomatic early on.
Okay, thank you very much. Dr. Gabitoya.
Actually, to sum it up all, no, we believe that still prevention is better than cure. So we
Yes.
do not want heart attack, stroke, or other cardiovascular disease to set in before we do something. So that's always our advice to our patients and even to their family members.
Yes.
Remember that family history is also a risk factor for them. So I think prevention is still better.
All right. Thank you very much. Once again, Dr. Alan Tenerife, President of Philippine Heart Association Negros Occidental Chapter, Dr. Mary Stephanie Varela, and Dr. Gabitoya. Thank you so much. Well, don't forget, an ounce of prevention is still better than a pound of cure. Always eat and live healthy. Exercise at least 1 hour a day. Make sure that you'll always have 5 servings of fruits and vegetables every day, not just once a month. Of course, limit your computer screening, or digital or iPad or whatever you have, gadget screening for 2 hours. Good luck to those who work in front of the computer for 8 hours a day. But make sure also that you limit your intake of sweetened beverages and salt. It's okay to eat bland as long as you're healthy and long. All right? So, well, that's it for today. Thank you so much for watching. Don't forget to live a healthy lifestyle so you can reach your maximum potential. I'm your host, Shari Hinete Ilon. Thank you once again to my guests here. I hope that everyone will continue to be blessed exceedingly abundantly this 2018. Go, reach for your dreams. Don't forget, anything worth doing is worth doing well. I'm your host, Shari Hinete Ilon. Here on It's Time with Shari.
New, fully furnished, 3 bedrooms, spacious receiving room, dining area, and kitchen. Your classy hotel in a strategic location, accessible with easy access to private and public utility vehicles. Ideal for visiting groups and families, with superior service and comforts of a hotel, yet uninhibited stay like a home. Jung's Realty Hometel. Since 1960, USI Credit and Finance Corporation, trusted for fast and personalized service. Chattel Mortgage, real estate loan, pension loan, and businessman's credit line. No processing fee, no hidden charges. USI Credit and Finance Corporation.